If you're watching this video, chances are your child has complex autism, and you suspect that they probably have whole body apraxia as well. But your therapist? They're still pulling beads at a therapy and using picture cards like it's 2005. And you're sitting there thinking, wait, my child is capable of so much more. Why aren't they seeing that? Now, here's what you have to remember though. It's not that your therapists don't care, it's that they were never taught about whole body apraxia in their education. And today, I'm going to show you exactly how to bridge that gap, advocate for your child, and know when it's time to stay or to move on. So let's dive in. Now, in this video, we're covering 4 critical things. First, how OTs and speech therapists are actually trained to work with complex autism. And guess what? It doesn't include whole body apraxia as part of their curriculum. Secondly, we're going to talk about what's missing from their education and why they don't know about this yet. Third, how you can advocate for your child even if you can't find an OT or speech therapist who understands whole body apraxia or presuming competence. And finally, when to stay with your current therapist and when it's time to move on. Hi, I'm Dr. Dana Johnson, an occupational therapist with a PhD in child mental health and development and advanced training in functional and nutritional medicine. I spent 2 decades working with children and adults with complex autism, and I hear from parents over and over again, my OT and speech therapists don't understand how to truly help my child. Well, let's talk about that. So here's what you need to understand. OTs, myself included, and speech therapists were simply not taught about whole body apraxia in their professional training, well, at least not at the level they should be. OTs do learn about motor planning, or what we call praxis. Speech therapists learn about childhood apraxia of speech and articulation issues. But here's the problem. Neither profession is taught to connect these dots when it comes to complex autism. Why? Because we're all taught that autism is primarily a social communication disorder with stereotypical behaviors like hand flapping, stimming, echolalia, and aggression. We're taught what to see, but not how to best support our clients, and whole body apraxia was never part of the discussion. So how are OTs taught to work with individuals with complex autism? Well, here's the typical list, and one, unfortunately, I am very familiar with from the past. We like to work on fine and gross motor skills, sensory processing and integration, social skills training, daily life skills or daily living skills like dressing and toileting, or any adaptive strategies to help out with things like that. I worked in the school system when I first became an OT, so success in the school or school readiness to help the students. Of course, there's visual schedules to help with understanding of complex things. And we're also taught to dumb things down because the assumption is that clients don't understand or they can't process what you're saying, so we have to use less words. We're also taught to shape the inappropriate behaviors. Now, thankfully, this is changing, but when I went to school, this was the norm. We need to help them become more socially appropriate. And here's what crushes me even more. We were never taught about presuming competence. And looking back at my career, I would have done things so much differently if I had been taught this very important mindset. Now, if you're not familiar with presuming competence or your therapist isn't, be sure to check out my video on the topic, which I will link in the description. Now, speech therapists are trained to focus on these key strategies when working with complex autism, and not surprisingly, they all are to do with communication. Augmentative and alternative communication, or AAC, and these are things like PECS, or Picture Exchange Communication System, where you use pictures to request items or to express needs. Sometimes they work on sign language, which is like teaching basic signs for common words and phrases, or use speech generating devices, the apps on the iPads that have symbols or text that speak words aloud. They use visual supports like schedules and visual cues to help understanding routines and directions, or social communication skills, teaching students how to interact with others or take turns and understand nonverbal cues like body language or facial expressions through role-playing and social skills groups. And finally, functional communication training, things like knowing when to ask for help, expressing feelings, or making choices and encouraging encouraging spontaneous communication in natural settings. Now, some may have more advanced training in things like prompt therapy or communication-specific programs. And these are all things that they were taught that would work best for those with complex autism. Okay, so what's missing from all of this? Well, first, the understanding that those with complex autism have challenges that go well beyond basic fine and gross motor skills. This is a breakdown of motor planning or praxis, which is called whole body apraxia. We were never introduced to it and how it's unique in individuals with complex autism. Instead, these delays were all lumped together in the fine and gross motor category. But everything we do, if you think about it, everything, including speech, is an intentional motor skill. So this needs to be part of all of our training, speech therapists and OTs. Second, the concept of presuming competence was not well understood or even taught. We were told that intellectual disability was typical if the individual had complex autism. So then what happens? Well, we pull out those fine motor activities or we play with the farm toys to label each of the animals with your 17-year-old client. Now, full disclosure, I did both those things. I'd also have my clients put popsicle sticks into repurposed coffee tins with a slit on the plastic lid. And I did this because other more engaging activities I thought were too high cognitive for them. We weren't taught to speak to them in an age-appropriate way, to speak directly to them instead of about them in front of them. Instead, we were trained to dumb down our language. Things like foot on, quiet hands, eyes on me, why is it so annoying? We were taught that due to their low ability to process information, we shouldn't repeat things a million times, but only once because they needed time to process. We were not taught that the most challenging thing for an individual with whole body apraxia is to start a movement. Literally, to initiate a movement is the hardest thing, closely followed by stopping a movement or inhibiting. And let's just talk about keeping the movement going or sustaining that movement. All of these things are so hard. We were not taught that motor coaching their body could help them build motor planning skills that also helped with communication and speech and independence. We were taught that ABA was the best method because they had so many inappropriate behaviors that needed to be changed. Speech therapists were taught that praxis was related to speech and forming words, not that it could affect the whole body and the individual's ability to intentionally move their body. The bottom line, we didn't know anything about what we should have known. Okay, so what do you do with this information? How can you advocate for your child when working with other therapists? Well, first, assume they would change things if they knew. We can't blame people for not knowing something they weren't taught. However, we can hold them accountable if they've been educated on whole body apraxia and presuming competence, yet they choose not to make any changes. That's on them. Next, talk with them respectfully about whole body apraxia and what it is. Make sure you're confident in explaining it. And once they understand that this is a motor planning breakdown, it will be much easier for them to presume competence. Then, of course, explain what presuming competence means. And remember, it means that the individual has the ability to learn and wants to learn, even if they can't demonstrate their understanding. And it's not the same as presuming knowledge. Just remember that, because that can be misunderstood. They should be speaking to your child in an age-appropriate way, teaching content at an age-appropriate level, and never speaking about your child in front of them without including them in the conversation. And finally, send them these videos. This is the main reason why I created this content. I want something that's easy to understand for both parents and professionals, and it's free. Now let's talk about the hard part, knowing when to stay and when to move on. Now, as I mentioned before, if your therapist isn't changing things after you've spoken to them about whole body apraxia, motor planning, and presuming competence, then you need to move on. This is about your child's progress and their dignity. Now think about it this way. If you were around a coach who didn't believe in you, disrespected you, and treated you like a child, how long would you stick around? Exactly. Now here are some red flags. If your OT continues to focus only on fine motor skills when your child clearly struggles with whole body movements, initiating their body, impulsivity, or pacing their body, what about reflex integration or vision issues? It's time to move on. Now, I've said this in previous videos. If your child is over the age of 8 or 9, you may want to consider a personal trainer instead of an OT. Now, obviously, they aren't going to work on specific OT-related things, but your child needs to work on building intentional and functional movement first anyways. After that, you can then address the other areas. If your speech therapist isn't able to understand that your child has whole body apraxia and can't connect their brain and body, which makes any form of communication, which includes signing, PECs, and all AAC devices, extremely challenging, then it may be time to consider moving on. Speech therapists need to understand that signing isn't necessarily easier than speech for an individual with whole body apraxia. It all requires intentional motor planning. They need to understand that your child has to be taught the motor skill first and practice it before they use it for any reliable communication. These are the things that we need to ensure that all therapists understand. Now listen, this journey can be really hard. You may be completely tired of fighting, of explaining, of wondering if anyone will truly see your child for who they are. But you're learning and you're advocating, and that matters more than you know. Your child deserves therapists who presume their competence, who understand whole body apraxia, and who are willing to learn and grow alongside you. Don't ever settle for anything less. If this video helped you, please give a thumbs up and share it with other parents and professionals who need to hear this message. Better yet, send it to your child's therapist. That's exactly why I made this. And subscribe to this channel for more videos on whole body apraxia, presuming competence, and how to advocate for your child in a world that doesn't always get it yet. And drop a comment and tell me, what's your biggest challenge in getting your therapy team on board with whole body apraxia? Your comments are so helpful for the content of this channel. And remember, you are your child's best advocate. Trust your instincts and never ever stop believing in their potential. Thank you, and I will see you on the next video.